Attorney Durso, we're going to call the jury, and are you prepared to call your next witness?
The state is prepared to go forward, Your Honor.
Okay, very good. So, Madam Clerk. Thank you. Welcome back, ladies and gentlemen of the jury. Counsel, would you please stipulate to the return of all our jurors?
Yes, Your Honor, the state would stipulate.
All right, thank you so much. Thank you. So we will, at this time, proceed. I'll ask the state to please call its next witness.
State will call Michael Egan to the stand.
Thank you. Good morning. Please enter the witness box. Please remain standing. Madam Clerk will put you under oath. Thank you.
Please raise your right hand. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you shall give concerning this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
I do.
Thank you. Please state your full name, spelling your last name, as well as your business address.
Michael Egan, E-G-A-N. My place of business is Echo Hose Ambulance, 100 Meadow Street, Shelton, Connecticut, 06484.
Thank you. You may be seated.
Thank you.
Thank you.
Good morning, sir.
Good morning.
Can you please tell the ladies and gentlemen of the jury what you currently do for a living?
I'm a paramedic with Echo Hose Ambulance in Shelton, Connecticut.
And did you have to go through any training to be a paramedic?
We did. It's a pretty extensive program. It's broken down by didactic, which is classroom, and then a clinical portion. My program was just under 2 years, approximately 1,800 to 2,000 hours.
And as a paramedic, are you also an EMT?
You are. I was an EMT first, and then you start as an EMT, and then you can work your way up. And if you choose to go on further, you can become a paramedic.
And what's the difference between being an EMT and a paramedic?
So EMT is considered BLS, which is basic life support. A paramedic would be advanced life support, ALS. On the EMT level, they can do bleeding control, CPR, AED, assist patients with taking some medications, administer a very small amount of medications. Paramedics can do far more. We can go into cardiac monitoring, some invasive procedures. We have a lot larger range of medications that we're allowed to administer. Our scope is just a lot broader than EMTs.
You had mentioned AED with regards to EMTs. What is that?
So that's a defibrillator, an automatic defibrillator. That is where you would apply it to someone who's in cardiac arrest. It analyzes a rhythm and then will determine if the patient should be delivered a shock or not. The machine determines that, not the provider, and that's why EMTs don't have extensive cardiac training like paramedics do. So the machine will determine that for them, or a layperson or anybody who's using it.
And what would a paramedic do in an instance where an AED would be used?
Paramedic, they would be hooked up to their what's commonly referred to as a life pack or a monitor, and the paramedic would be interpreting that rhythm based off their knowledge versus the machine doing it. And the paramedic would make the decision to, if the rhythm had to be shocked or defibrillated, the paramedic would make that decision versus what the machine making that decision.
Okay. Now, were you working back on May 15th of 2022?
I was.
And in what capacity were you working?
I was an EMT at that time.
And where were you an EMT?
At Echo Hose Ambulance in Shelton.
And EMT, what does that stand for?
Emergency medical technician.
And what shift were you working then?
I was working 6 p.m. that night until 6 p.m. the next morning. I was on a 24-hour shift.
So you started on the 14th into the 15th?
The night of the incident is when I started at 6 p.m.
Okay. And you were slated to get off at 6 a.m. the next?
6 p.m. the next day, yeah, 24. We call it a reverse 24 because you start later in the day.
Okay. And did you have an occasion to respond to a report of medical need at 43 Laurel Glen?
I did.
And I want to direct your attention to State's Exhibit 1 behind you. Is that the area in which you responded that just for the record, the red dot there is 43 Laurel Glen.
That is, yes.
Okay. And when you got there, can you please just, actually, withdrawn. I'm going to show you State's Exhibit 2. Again, is this the house that you responded to that night?
That is.
On a report of medical, someone who needed medical attention.
Yes, sir.
Okay. And when you got there on what time did you get there?
I believe the call was dispatched just before midnight, and we arrived a minute or two after midnight.
Okay. So for all intents and purposes, you arrived there on the 15th of May.
Yes, sir.
So when you got there, can you describe to the ladies and gentlemen of this jury what the scene was like?
Sure. So when we arrived, the police were obviously there. I think there was maybe 1 or 2 units. I can't remember specifically. And there was a large group of people on the front lawn. We pulled just past the residence to leave room for additional ambulances because at that point we had been told there was multiple patients. We got out of the ambulance. We were encountered with a very large crowd. It was rather chaotic. People were screaming and yelling. We knew there was, possibly four patients at that time, so we started our triage. We came across the first patient. In this picture, if you kind of see, there's a cluster of, looks like kind of garbage. That's right around where we found the first patient.
I'm going to show you State's Exhibit 5.
Sure.
This is a daylight picture, essentially the same area.
Yes.
Can you use State's 5 to kind of describe what you did?
Yeah, so there's that red tree right there, just in front and to the right of that red tree. We found our first patient. He was laying supine on his back. He was completely unresponsive. His breathing was spontaneous but erratic, which is not a good sign. We immediately checked in times like that for triage, we immediately checked for a pulse, which he had a very weak 30 pulse, which is another bad sign. And he did not look well. You can look at someone that's very sick and determine they don't look well. So we do a rapid trauma scan, which is we check for any major bleeding. So we did that. I remember his shorts were absolutely saturated in blood. And we found a puncture wound to his upper left abdomen, kind of his left lower chest area. So when we come across a wound like that, where there's suspected trauma, you apply what's called a chest seal. In the event that there is a punctured lung, it can help stop that lung from collapsing any further. So we applied that chest seal. At that point, we didn't see another major bleeding, so my partner broke off and continued to triage the rest of the patients. And when I went to reassess that patient that was laying there, we noted that he had stopped breathing at that point. I reassessed the pulse, and he had no pulse.
So you mentioned triage. What is triage? Can you just explain?
Yeah, of course. So triage is when you get onto a scene and you're overwhelmed by patients for the amount of resources you have immediately available. You have to determine who is in the worst shape and who could benefit most from the help. So if you come across someone that is in cardiac arrest and deceased and you have 4 other patients, you're not stopping to help that patient. Unfortunately, you're moving on to someone who can still be helped. Because if you stop to help that person, their odds are very slim. Now, someone else who had another chance to survive, their odds are going down because you're spending time on this person who really has no shot.
Okay. So on the night in question, when you got there, is it safe to say, based on what you've told us so far, when you got there, you attended to the first patient that you saw?
We did, yep.
And that patient, based on your assessment, was still breathing and had a pulse?
Yeah, it was a very weak 30 pulse, and his respirations are very erratic, but they were spontaneous, so he was still breathing technically.
And when you applied the chest seal, I think you said, what if anything, did that do for the patient?
In this case, I don't believe it did much because when we went to reassess him right after that, he was in cardiac arrest. So I don't think it did anything.
So when he went into cardiac arrest, what, if anything, did you do next?
So when someone goes into cardiac arrest, we immediately apply the AED. The AED will analyze a rhythm. While we're setting up the AED, we'll start CPR. But in a witnessed arrest, you want to get the AED on as quick as possible. The witness arrest meaning he went into cardiac arrest right in front of us, because odds are he's probably in a rhythm that can be shocked. So we started CPR. I had 2 bystanders there. One said she was a nurse. One said he was a neighbor that was trained in CPR. Because at this point, my partner was triaging the rest of the patients. So I directed them to start CPR. We applied the AED. You step back and the AED analyzes. It told us that there was no shock advised. And then we retrieved a BVM, which is a bag valve mask. It's called bagging. We applied it to him, and we began delivering respirations and CPR in 2-minute cycles.
Now, when it was no shock advised, what does that mean?
So the AED will analyze a number of heart rhythms, but there's only 2 rhythms that you can shock: ventricular tachycardia and ventricular fibrillation. And the AED will only deliver a defibrillation. Fibrillation. I meant to say fibrillation. Atrial fibrillation and ventricular tachycardia. Sorry. Ventricular tachycardia and sorry, I'm drawing a blank. VFib, ventricular fibrillation. Sorry. Those are the only 2 rhythms that can have a defibrillation delivered to them. So the AED won't deliver a shock to anything else besides that. So when it says no shock advised, it means it wasn't in one of those rhythms. I can't tell you what rhythm it was. It doesn't tell you what it was. It just means it wasn't one of those.
Okay. So when you applied the AED, you received that information. What, if anything, what steps did you take to continue to render aid to that individual?
Sure. So we insert an OPA, which is a small piece of plastic that's curved that helps keep the tongue forward to help deliver ventilations a little more effectively. And then we do CPR at a rate of 30 compressions to 2 ventilations. And we do that in 2-minute cycles. And the AED will count down and it will tell you to stand clear and analyze. It will analyze, tell you if there's a shock advised, no shock advised. And then you just continue doing that in 2-minute cycles.
Now, what was the scene like around you when this was going on? Do you recall what the scene was like, or were you completely?
Yeah. So it was as I mentioned before, it was pretty chaotic. There was quite a few people that were screaming. A lot of people in distress. I remember it was dark. One of the police officers was providing light to us with a flashlight, but even then, that wasn't like there 100% of the time. So it was fairly chaotic.
Was it so dark where you couldn't see what you were doing in front of you?
No, I could see what I was doing, but it was dark, but I wouldn't say it was like pitch black where I couldn't see anything. I believe there was, I feel as though there was light coming from the house as well. We have scene lights on the side of our ambulance that we turn on as well, that are kind of like floodlights that provide light. In this case, the ambulance was fairly close to where we were working on this patient.
And in looking at this exhibit here, State's Exhibit 5, was your ambulance parked somewhere in the area of this, on the street here?
It was, yeah. If you look at that reddish tree, I'd say we were just past that.
Okay. Now past it to the right? Or
to the right.
Okay. And with regards to Stage 5, can you tell where you were working on the patient you just testified to in Stage 5?
Yeah, so there's like a cluster of looks like white garbage. Yeah, right there. I'd say it was right in that area because that looks like the remnants of kind of what we leave behind sometimes in emergent situations. A lot of the wrappers of things that we use.
Your Honor, if the record can reflect that, I'm pointing to what appears to be the lower right-hand corner of the grass area where there is white, it's like maybe gauze pads or debris or medical material.
All right, thank you, Attorney Durso. The record shall reflect that. Thank you.
Now, you said you were an EMT back on May 15th of 2022.
Yes.
Did a paramedic arrive to the scene at some point?
He did. I would say just over 5 minutes, anywhere in the 5 to 10 minute range. A paramedic arrived at that point. Our primary paramedics were from a service called VEMS, Valley EMS, and they are out of Seymour. So anytime that there's a call that is considered advanced life support, they will also come in addition to us.
And when do you know the name of that individual? That
Jeff McKe.
And when Jeff responded to the scene, were you present when withdrawn? When Jeff responded to the scene, did he take over care of that patient?
He did. We give a short handoff report of what we encountered, what we've done, and then he assumes primary patient care.
And when you handed off care to Mr. McKe, what, if anything, did you do or did you observe at that point in time?
At that point, I believe we did not spend much time working on him there. We moved him onto the stretcher. We moved the stretcher into the ambulance, and then we started transporting a short time later.
And what were your responsibilities with regards to transport?
During transport, I was driving.
Okay. And who went with you withdrawn? Did you go to the hospital?
Driving, I did, yes.
Okay. And what hospital did you go to?
Bridgeport.
And who was in the ambulance with you while you were driving?
It was Jeff McKe and my partner.
And who was your partner?
Sophia Kaiser.
And what is the protocol when you withdrawn? How long would you say it took to get from 43 Laurel Glen to Bridgeport Hospital? I
can't recall the exact time. I don't want to guess. I can't give you, it's hard for me to give you a number on that.
When you were driving from 43 Laurel Glen over to Bridgeport Hospital, does the ambulance you were driving, does it have lights and sirens on it?
Yes.
Did you in fact initiate the lights
We
and
did, yep.
sirens?
Mhm.
And okay, and when you get to the hospital,
Mhm.
any given patient that you deliver to the hospital, what's the protocol for handing off to the hospital?
Yeah, so generally at Bridgeport Hospital, we touch base with what's called the EMS triage nurse. She'll check the patient in. You give a handoff report to them, and then they'll assign the patient depending on the acuity of that. In calls like this, we do what's called a radio patch, where you call into the hospital ahead of time and let them know what you're coming in with, and you try to impress on them the seriousness of the situation. So when that happens, a lot of the times you won't stop at EMS triage. You'll bypass them and go directly to the trauma room where the trauma team will be waiting.
And that happened in this case?
It happened in this case, yes.
And once you handed off the patient to the hospital at that point, what if anything, did you do in relation to this case?
At that point, I just removed the stretcher from the trauma room. We go back to the ambulance and we begin to decon so we can get back in service for if there's any additional calls coming in.
Thank you. I have no further questions.
Thank you. Attorney Smith?
Thank you, Your Honor.
You're welcome.
Good morning. How are
Good
you?
morning, sir. I'm good. How are you?
Good. You talk a little quick, Mr.
I'm
Egan.
sorry. Yeah, I tend to do that.
So I'm going to maybe ask you to just slow down a little bit
I'll do
for
my
us. I just
best.
want to go over things, okay?
Sure.
You used a term right there at the end, which I was unfamiliar with. Maybe the jurors are unfamiliar with as well. You said after you took the stretcher out and went back to decontaminate.
Decontaminate.
Decon.
Yep.
Gotcha. Decontaminate. Thank you. All right. So you were telling us, Mr. Egan, that you arrived on scene and it was chaotic, correct?
Yes.
In fact, you said people were screaming, correct?
Mhm.
Yelling obscenities, correct?
Mhm.
And in fact, yelling obscenities at you and your crew member, Ms.
Yep.
Kaiser, correct?
Yeah, it happens frequently.
You said that the crowd was difficult to part to get to the patients.
Mhm.
Ultimately, however, you did get to the patients.
We
correct?
did.
And you said one of the patients was standing and able to talk.
I didn't write that in the chart. I believe Sophia might have written a addendum after she went and triaged, but I did not encounter any standing patients.
You didn't encounter any standing patients. You
No.
encountered one person who was laying down on the grass, correct?
Yes.
And then you rendered some aid to the person that you indicated or believed was the most in need of your care. Is that fair to say?
Yeah, he was the first one he came across. So we do a rapid scan. And then, after we did the rapid scan, applied that chest seal, my partner moved on to assess the rest of them. And then I began working doing the AED CPR.
Any indication that these yelling, screaming folks had been drinking?
I did not witness any alcohol, so I can't comment on that.
Did you feel threatened at all?
I didn't feel threatened, no. I didn't feel the obscenities were being yelled like at us in a violent method. It was more like, hurry the blank up, he's blanking dying, things like that.
Okay. And yet they were still difficult to part for you to get to the patient?
Yeah, because it was very chaotic. So situations like this, people tend to move in on the patients. You have to be like, hey, excuse me, move out of the way, give us some room.
You mentioned that you parked up to the right of where that red bush is on the
Yeah.
exhibit that you were shown. There were cars parked along the roadway?
I can't remember if there were cars parked like directly in front of the house or where they were, to be honest.
Do you recall whether or not there were cars parked in the driveway?
I do not recall, no.
You were solely focused on trying to get to the patients?
Yes,
Yep. And when you got to this patient that you have described to us rendering a lot of aid to, you noticed that there was a puncture wound to the left lower chest, correct?
Yeah, left lower chest or upper abdomen, right in that area.
That was the only wound that you saw on this individual that you were treating?
That's the only one I observed at that time, yes.
And you described that it was rather dark in the area, correct?
Yes, sir.
You said that an officer may have been providing some light to you.
I remember there being a flashlight at one point, but it wasn't consistent the entire time.
You also had a light you described to us that was on your vehicle itself, correct?
The scene lights, yeah.
The scene lights.
Yep.
Those, however, didn't provide a ton of light. Is that fair to say?
No, yeah, it's not adequate by any means to completely light the scene up, no.
Gotcha. And this night was also rainy and misty, was it not?
I don't remember the weather, to be honest with you.
Do you recall whether or not the grass was wet where you were?
I do not.
Do you recall, you said you were the driver, correct?
I was, yep.
Do you recall whether or not you had your wipers on as you were driving to the scene?
I don't recall.
And then you described for us rendering aid. At some point you were joined by Jeff McKe, correct?
Yes.
You handed off to him. Did he stay in the vehicle with you as you drove to Bridgeport Hospital?
Like, did he stay in the ambulance with us?
Yes.
Yeah, he was in the back working on the patient.
So in this vehicle was you, the patient, Ms. Kaiser, and Mr. McKe, correct?
Yes.
And sir, you've been called here today to tell us what you witnessed when you responded to the scene.
Yes.
You've done that to the best of your ability.
Yes, sir.
But if what these jurors are interested in is why Mr. Valley did what he did that night, you can't really be of any help to these jurors.
No, sir.
Thank you. Nothing further.
Thank you.
Thank you. Any redirect?
No, Your Honor, thank you.
Did you say no?
No, Your Honor, thank you.
Thank you. All right, sir, you may step down.
Thank you.
Please watch your step. Thank you. Is the state prepared to call its next witness?
Yes, Your Honor. State will call Jeff McKe to the stand.
Thank you. Good morning. So if you'd please enter the witness box, please watch your step. Please remain standing once you're in the box. Madam Clerk will put you to oath. Thank you.
Please raise your right hand. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you shall give concerning this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
Yes, I do.
Thank you. Please state your full name, spelling your last name, as well as your business address.
Sure. Jeffrey McKe, McKee is last name, and Valley Emergency Medical Services, 764 Derby Avenue in Seymour, Connecticut.
You may be seated.
Thank you.
Thank you. You may proceed.
Thank you, Your Honor. Good morning, Mr. McKe.
Good morning.
Can you please tell the ladies and gentlemen of the jury what you do for a living?
So I'm a paramedic providing advanced life support. I've been working with Valley Emergency Medical Services for a little over 4 years. And prior to that, I was an EMT for about 10 and a combat medic in the Connecticut National Guard.
Did you have to go through any training or education to be a paramedic?
I did. I went through just about 18 months worth of didactic and skills training, as well as clinical at Capital Community College to obtain my paramedic license.
And what's the difference between a paramedic and an EMT?
So an EMT does what's called basic life support, where they can perform CPR, administer oxygen, basic medications, and do very basic assessments of patients.
And what does a paramedic do?
As a paramedic, we're a more advanced level of care where we can initiate IVs, we can intubate, provide advanced airways, and give a bunch of medications that we're trying to give.
And how long have you been a paramedic?
I've been a paramedic for just over 6 years.
And I want to direct your attention to May 15th of 2022. Were you working that day?
I was,
In what capacity?
as a paramedic.
And did you have an occasion to respond to 43 Laurel Glen on that day?
I did.
Okay, and I want to direct your attention to states 1, where that red mark is right behind you on that exhibit right behind you. Is that the home, the residence that you responded to on that night?
Yes, it is.
Around what time did you say you arrived to the scene?
I arrived at the scene shortly after midnight.
And what was the information that you had in relation to responding to that scene at that night?
I was dispatched for a possible assault with possibly multiple victims on a priority 1 as the first incoming paramedic from out of town.
And what does priority 1 mean?
So it means lights and sirens.
And why would you put on lights and sirens?
It was reported as a critical call that required a paramedic or advanced life support to respond.
So what time would you say you arrived there?
I believe it was shortly after 20 after midnight, somewhere in that time frame.
And when you got there, I want to direct your attention to stage 5. It's on your screen there. Is this the area that you responded to at 43 Laurel Glen?
Yes, it was.
And when you got there, can you tell the ladies and gentlemen of the jury, if you can, in states 5, where you responded to? What did you do when you got there?
So upon arrival, there was a lot of individuals on scene as well as police and care providers. I was directed to the patient that was On the lawn, sort of where all the trash is to the right of that red bush.
So just so we know we're on the same page, I'm pointing to, for the record, you're on the right side on the grass area where there appears to be medical material in States 5. Is that where you were?
Yes.
So anyway,
Thank you, Your Honor. And when you got there, can you tell the ladies and gentlemen of the jury what you observed?
So upon arrival, I observed a chaotic scene with a lot of younger individuals crying, screaming, upset, and I observed the Shelton ambulance on scene with a patient in the grass there performing CPR with a bystander as well as PD officers around, and that's the patient I was directed to. I know there was another paramedic on scene who had triaged, and that's the patient, my most critical patient I was directed to.
So were you aware that there were other patients at the scene?
I was told there was en route to the scene, and there were providers on scene that directed me to the patient that was in the front lawn that you mentioned right there.
Okay, and when you got to that patient, can you tell us what care, if any, you provided to that patient?
Sure. So I got the report from the EMT that was performing CPR on the patient, and he had placed an AED and an oral airway in the patient upon finding out that the patient was pulseless. So I had them continue CPR and connected them to my cardiac monitor via the AED pads that were previously placed. Did a brief pause, checked for a pulse, checked for breathing on the patient, as well as checked the initial heart rhythm, which was asystole. Upon doing that and determining there was no pulse and no breathing, directed CPR to be continued, as well as ventilation with oxygen.
What is asystole?
Asystole is essentially flatline, where there's no cardiac electrical activity originating on top of the heart or in the heart whatsoever.
When you got to the scene, what did you observe about the patient outside of your assessment of the patient medically? What did you observe about the patient?
The patient was a young male in his teens. The patient appeared to be in good shape, healthy.
Did you observe any wounds on the patient?
I did. Observed a small puncture wound right under the patient's left nipple in the area of the chest with a chest seal that was placed on there prior to my arrival.
Was there any active bleeding at that point?
There was bleeding in and around the site. The chest seal was doing a decent job of controlling that bleeding, and there was direct pressure being held on that upon my arrival.
And when you medically, when you assessed the patient at that point in time, and you said they were in asystole,
Yes.
what steps did you take at that point when you determined that CPR should continue and there was a flatline?
So at that point, I continued my trauma assessment on the patient to determine if there were any other wounds or hemorrhage that needed to be stopped, while the EMT partner and the other provider provided quality CPR to the patient. And then if there was any additional bleeding that needed to be rectified before moving the patient.
How long would you say that you were on the scene providing medical care to that patient when you got there?
No more than 15 minutes from the time I made patient contact to getting the patient in the back of the ambulance and starting transport.
Why did you withdraw? Did you determine that the patient needed to be transported to the hospital?
I did.
Okay, and why did you determine that?
I determined that because upon arrival of the first responders, they said the patient still had a pulse, a palpable pulse, and just prior to my arrival that had been lost. So it's technically what's called a witnessed arrest, which a provider witnessed the cardiac arrest. So there was still a chance for us to provide life-saving measures, and that's what I did.
And at some point, you transported the individual to the hospital?
Yes.
Okay. And what did you do between the time you placed them on a
Backward.
backboard, put them in the back of the ambulance and transported them to the hospital? What life-saving measures, can you explain what you did at that point?
So once we got the patient off of where they were found into the back of the ambulance, I noticed that the chest seal was not holding well. So I replaced that to stem the continued bleeding. CPR continued. I attempted to get IV access on the patient. However, his vasculature did not support IV access, which I went to what's called an intraosseous infusion, which is a drill through the tibial tuberosity on the left leg, where you can infuse medications, fluid directly into the bone marrow.
So you're in the back of the ambulance?
Yep.
Who's driving?
So one of the EMTs was driving to the hospital.
And you tried to administer medication
Yes.
in the patient's veins?
And through the intraosseous infusion.
No, why did you do that? Why did you do an intraosseous? Can you explain that to the jury?
Yes, so I did an intraosseous infusion because the patient did not have veins or vasculature that was apparent to me, either due to hypovolemia, which is lack of fluid or blood, or poor vasculature. So in an emergency situation like that, the next choice is to do an intraosseous infusion in through the bone marrow.
Okay, and how do you do that? Can you just explain that to the jury?
So it is a needle attached to a drill, and you use the drill to drill through the outer layer of bone in the select spot. And once it is through that first layer of bone, you stop and you're able to flush into the bone marrow with fluid or medication.
And why is that? Why are you trained to do it that way?
So we're trained to do that way in the instances that you cannot get an IV and that there's no vasculature available to obtain an IV while still being able to provide care, to provide emergency care.
And when you provide medicine in that manner, how does that get into does it get into the body faster?
It does. So it travels through the bone marrow directly into the heart and then to the rest of the body once it's pumped through the vasculature.
And you did that in this case?
Yes.
And what medication did you provide the patient at this
I
point?
provided epinephrine, which is our standard advanced cardiac life support drug to try to resuscitate a patient that's in cardiac arrest.
And in this particular instance, after you applied that epinephrine, was it successful in reviving any type of heart rhythm?
It was not.
And can you tell the ladies and gentlemen of the jury what you continued to do on the ride from 43 Laurel Glen to the hospital?
Absolutely. On the transport down, I continued to give epinephrine every 3 to 5 minutes with a total of 4 doses to try to restart the patient's heart. I also continued CPR on the way down, and when the chest seal was no longer effective, applied a pressure dressing, which stemmed the bleeding that was continuing and stopped the bleeding with that. I also intubated the patient to get a definitive airway, which was confirmed on my cardiac monitor and listening to it as well. So ventilation while after being intubated, as well as CPR continued, as well as a normal saline drip to try to put some volume back into the patient.
Now, when you initially got to the scene and you assessed the patient, did the patient have a pulse on the scene when you saw?
No. When I got to the patient, they did not.
And from the time you left 43 Laurel Glen to the time you got to Bridgeport Hospital, did you assess the patient for a pulse during that period of time?
I did. Every 2 minutes I assessed for a pulse. I also assessed for any cardiac rhythm or activity on my cardiac monitor, which the patient remained in asystole throughout the transport at that every 2-minute interval.
And how long would you say, if you can recall, the ride to the hospital was from 43 Laurel Glen to Bridgeport Hospital?
It felt to be between 15 and 20 minutes.
And at some point in time, did you arrive at Bridgeport Hospital?
We did.
And could you explain what happened when you arrived at Bridgeport Hospital?
So when we arrived just prior, I had given a trauma alert patch to the hospital, advising them what I had found on scene, what interventions I had done on the way down, and what to expect when we arrived. When I got there, CPR continued into the emergency department. We rolled into the trauma room, and CPR continued throughout that process. I had the attending doctor and the respiratory therapist confirm my intubation and my tube placement, that it was accurate. And I gave a report to the attending physician and nurses that were there. And then the patient was moved over to the hospital bed, and the staff continued their resuscitation process.
And at the time that you handed the patient off to the hospital, at that moment, did you do any final assessment as to any type of pulse or activity with regards to
I did. Just prior to bringing them into the ED, I did a final pulse, breathing, and cardiac rhythm check. The patient remained in asystole, remained pulseless, and remained not breathing. So we continued CPR from the ambulance in through the ED, with the ED staff taking over CPR.
I have no further questions.
Thank you. Attorney Smith, any redirect? Any cross?
Thank you, Your Honor.
Thank you.
Good afternoon, Mr. McKe.
Afternoon.
Just want to go over what you've told us here and make sure I got this correct. When you responded to the scene, you encountered a chaotic scene. Is that fair to
Yes.
say? People screaming.
Yes, crying, yes.
And did you have any trouble getting to the patient?
I did not.
Path was cleared for you at that point?
Yes,
You were directed to this patient by other responders that were already on the scene.
yes.
You told us that you did an initial trauma assessment, correct?
Yes,
That included trying to find whether or not there were any other wounds, correct?
correct.
You didn't find any other wounds, did
I
you?
did not.
You also looked for other bleeding, correct?
Yes,
Didn't find any other bleeding, correct? You looked for other trauma, is that fair to say?
yes,
And you didn't discover any other trauma?
No.
Just what you've noted as being a small wound, one small puncture wound to his chest under the nipple, I believe, correct?
correct.
Did you see any signs of alcohol or drinking when you got to the scene?
I did not notice.
Do you recall the conditions that evening? Was it rainy, misty?
It was misty, the roads were damp.
The grass itself, do you recall whether or not the grass was wet?
It was damp.
That caused you to slip or anything while you were setting up?
No.
And then you described for us the level of support that you gave to the patient, correct?
Yes,
And that, I believe you told us at some point you determined that he needed transport, correct?
correct.
And you determined he needed transport because it was what you described as a witnessed arrest, correct?
Correct.
Meaning that the people who had responded to the scene had gotten some indication of a pulse, correct?
Yes,
And some heart activity, correct?
yes,
And however, by the time you arrived, there was this witnessed arrest, which meant that there was still a chance to provide life-saving measures, correct?
yes.
And that's why you determined it was time to take this patient, transport him to Bridgeport Hospital, correct?
That is why. Yeah.
Which you did, and then you transferred care once you were there over to the attending physicians,
I
correct?
did.
And so, Mr. McKe, you've been brought here today, fair to say, to tell us what you witnessed and observed when you arrived on the scene.
Correct.
But if this jury was interested in knowing why Mr. Valley did what he did that night, you wouldn't be able to help them at all, would you?
I would not.
Thank you.
Does the state have any redirect?
No, Your Honor, thank you.
All right, thank you. Sir, you may answer the witness box.
Thank
You're
you.
all set. Thank you.
We approach.
Sir. All right, so ladies and gentlemen seated in the gallery, as well as anyone watching live stream, it's been brought to the court's attention that the next witness is going to be from the Office of the Chief Medical Examiner. Sensitive and/or graphic material may be discussed and/or displayed in terms of the evidentiary portion of this testimony. So at this point in time, I would ask you to use your own discretion as to whether or not you would like to remove yourself from the proceedings or turn away from the live streaming. Thank you. All right, this time the state can go ahead and call its next witness.
Thank you, Your Honor.
Thank you.
State calls Dr. James Gill to the stand, please.
All right. Good afternoon. If you could please step into the witness box and remain standing. Madam Clerk will put you under oath. Thank you.
Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you shall give concerning this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
I do.
State your full name, spelling your last name, as well as your business address for the record.
James Gill, Gill, 11 Shuttle Road, Farmington, Connecticut.
You may be seated. Thank you.
Thank you, Your Honor.
Good afternoon, Dr. Gill. How are you today?
I'm well, thank you.
Good. Dr. Gill, where do you currently work?
I work at the Office of the Chief Medical Examiner in Farmington.
And for how long have you been with the Office of Chief Medical Examiner?
Since July of 2013.
And what is your current position with that office?
I'm the Chief Medical Examiner for the State of Connecticut
And how long have you been in that position?
since July of 2013.
Please tell members of the jury what your educational background is, as well as the experience that qualifies you to have the position that you hold.
I received a degree in biology from MIT, followed by my medical school at the University of Connecticut,
I did an internship in medicine in Vermont, followed by my pathology training at Yale. I did a fellowship in cancer pathology at Memorial Sloan Kettering, and then a fellowship in forensic pathology at the New York City Medical Examiner's Office. I'm board certified in anatomic and forensic pathology and licensed to practice medicine in Connecticut and New York.
And what are your duties as the chief medical examiner?
I have administrative duties as well as investigative duties. So I'm kind of the commissioner of the agency, but I also do a medical legal death investigation. So that includes performing autopsies and certifying deaths.
And please explain generally what the term pathology entails.
So pathology is that area of medicine that deals with the laboratory aspects of the body. So things that can go wrong with the body. And typical pathologists usually work in the hospital and they'll examine different tissue samples from the operating room and so forth to determine if there's cancer or what have you.
And is there a difference between pathology and forensic pathology? And if there is, what is that difference?
Yes, so forensic pathology is a subspecialty of pathology that requires additional training, and it's that specialty that deals with the investigation of sudden, suspicious, or unnatural deaths. So deaths that are related to trauma, injuries, intoxications, things like that.
And up to date, if you can approximate how many post-mortem examinations you have conducted?
I've performed over 4,000 autopsies and many thousands more of examinations of bodies.
Do you primarily oversee the autopsies of other members of your office, or do you conduct them independently?
I do both. I actually yesterday I did 2 autopsies yesterday, but I also oversee the office.
In your career, have you conducted or overseen autopsies or examinations where the cause of death was a stab wound?
Yes.
And can you approximate how many times?
Many dozens of times, both homicidal as well as suicidal self-inflicted injuries.
And prior to today, have you testified in court on the field of forensic pathology?
Yes.
Prior to coming to court today, did you have an opportunity to review any records from your office to prepare for your testimony?
Yes.
And did you review the postmortem report that was prepared for this case?
Yes, I did.
And did you review any additional reports that may have been part of that postmortem report?
Yes.
And which reports would that be?
Those would include the toxicology report and some other laboratory and investigative reports.
Do you have the opportunity to review any photographs with relation to this case?
Yes.
And are photographs always taken during forensic examinations or withdrawn postmortem examinations?
It's a routine part of a forensic postmortem examination.
And what's the reason for that?
It's to document findings as well as sometimes the absence of findings, so other people can look at it and evaluate it as well.
Now, did you personally perform the autopsy on the body of James Thomas McGrath?
No, I did not.
And to your knowledge, who performed the autopsy?
It was Dr. Jones.
And to your knowledge, what position did Dr. Jones hold with the Office of the Chief Medical Examiner?
She was I believe, an assistant medical examiner. She was in her training year as a forensic pathology fellow.
And were you present and overseeing Dr. Jones when she performed that postmortem examination?
Yes, I was.
And why the oversight?
Because she's still in training, and so we supervise them, kind of work side by side with them so they can learn forensic pathology.
And to your knowledge, is Dr. Jones still employed by your office?
No, she's not.
And do you recall what date Dr. Jones performed that postmortem examination?
I'd want to look at the report just to refresh my memory, but it was May 15th, 2022.
And to your knowledge, where was that examination conducted?
At the office in Farmington.
And how do you know that?
I was there, and there's a record in the autopsy report describing the location and the time and the place.
May I approach the clerk, Your Honor?
Certainly.
May I approach Attorney Smith?
Yes, you may.
No objection, Your Honor.
All right, thank you.
First witness.
Yes, you may. What number is this?
I'm sorry.
It's okay.
States 10 for ID.
Thank you.
Dr. Gill, I'm showing you what's been marked as states 10 for ID purposes only at this point. Do you recognize this document?
Yes.
Okay. And to your knowledge, who prepared this particular document?
Dr. Jones prepared the autopsy report, and the toxicology report was prepared by the laboratory, and she also prepared the lab request form.
And was this report primarily the report from the Office of the Chief Medical Examiner prepared in the regular course of business of that office to prepare such a report?
Yes.
And is it in the regular course of business for your office to prepare such reports on a daily basis?
Yes.
And was that report made at or near the time that postmortem report was withdrawn? Was that report made at or near the time the autopsy on James Thomas McGrath was performed?
Yes.
I would just ask for 15 minutes as a full exhibit, Your Honor.
Attorney Smith?
No objection, Your Honor.
All right, court will accept into evidence as a full exhibit, states 10. Thank you.
Dr. Gill, I'm going to be asking you some questions based on states 10, approaching the witness, Your Honor. You may read from this report now that it is a full exhibit. Dr. Gill, who was also present at the postmortem examination in addition to you and Dr. Jones?
Dr. Vincent, one of our medical examiners.
And in addition to members of your office being present, do you recall if anyone else was present during that postmortem examination?
I don't recall anyone else being present.
Is it typical for members of the police department to come in and view the autopsy?
Usually, yes. It depends upon the type of death and the case and so forth, but it's not unusual for police or investigators to attend the autopsy.
If someone from the Shelter Police Department were present, would that be noted in that report?
It may or may not. Some doctors don't always include the police who are present or not.
Prior to the postmortem examination done on James Thomas McGrath arriving, prior to the examination being done on James McGrath, did you or any of your coworkers have any knowledge of what the extent of the injuries were?
Yes.
And where did you get that information from?
The death was called into our office from the hospital, and so we get preliminary information from the hospital.
And looking at State's Exhibit number 10, how old was James Thomas McGrath at his time of death?
He was 17 years of age.
And to your knowledge, do you know where James Thomas McGrath was pronounced dead?
I have to look at the death certificate or Bridgeport Hospital.
And to your knowledge, were any operations or procedures conducted on James McGrath prior to his arrival at the medical examiner's office?
Yes,
And how do you know this?
from the autopsy report.
And how was the body of James Thomas McGrath transported or brought to the office of the chief medical examiner's office?
We have a transport team that will pick up remains at the hospital and bring them to our office.
Typically, and in this case as well, do you recall how the body was brought in? What condition?
The body was brought with resuscitative equipment still with the body in a body bag.
And was there an ME case number assigned to this examination?
Yes.
And referring to exhibit number 10, can you recall or can you tell the members of the jury what that ME case number is?
Yes. It's 22-10921.
And what is the significance of that ME case number?
So 22 is the year, and then we give each death that's reported to our office a unique sequential number. So it's a unique number for Mr. McGrath.
Can you please tell the ladies and gentlemen of the jury generally what goes on in a post-mortem examination, if you could give details as to what is conducted?
It depends a little bit on the type of death, but generally in a case like this, we would do x-rays of the body. And then we would do what's called the external examination, where we look at the outside of the body, looking for identifying features, color of the eyes, length of hair, any evidence of injury or medical treatment. And we would take photographs, and then we would do the internal examination, where we make a Y-shaped incision and examine the internal organs to determine largely why the person died.
I'm going to direct your attention to States 10, where it says external examination. What is the purpose of that section?
So that, again, is to document the different physical characteristics of the body, color of the eyes, scars, tattoos, things like that.
And where it says under postmortem changes, what does that paragraph indicate? This is page 2 of 5.
So that's where we would describe any changes that we see from occurring after death, like rigor mortis, stiffening of the body temperature, lividity, the settling of the blood, change in color of the body after death.
And as indicated before, you said that there was some medical intervention that was done. In looking at States 10, can you please explain what was done or what was present on the body of James Thomas McGrath?
He was received with a breathing tube in his airway, as well as 2 catheters, intravenous type catheters actually in the bone on both lower legs.
And is that what is referred to as therapeutic interventions on States 10?
Correct.
Again, referring to States 10, under where it says injuries, external and internal, what evidence of injury was present on the body?
So there was evidence of both sharp injury and blunt injury. So sharp injuries are injuries that are caused by sharp objects like a knife, a piece of glass, and you can either have a stab injury or a cut injury. The difference is that stab wounds are deeper into the body than they are long on the skin, while like a cut or an incised wound is longer on the skin than it is deep in the body. Blunt injuries are different types of injuries. Those are injuries caused by blunt force, where a person may fall down and bruise their knee or what have you. We call those contusions. So he had some bruises as well on different parts of his body that were just very superficial.
So in addition to those superficial bruising you had indicated, was there also a stab wound found on the body of James Thomas McGrath?
Yes.
And where was that stab wound located?
The stab wound was on the left chest below the left nipple.
Can you either read or explain the directions? Within the exhibit, it indicates the directions are stated with reference to the standard anatomical planes with the body measured in the horizontal position. What does that refer to?
So we don't know what position the person was in when they were stabbed. So we always give the directions in the anatomical position, which means standing straight up with your arms at your side. So we all have the same planes of reference. So for example, in this instance, the stab wound was going from the front of his body towards the back of his body. And it was going, from the left of his body towards the right of his body, and then slightly upward in his body.
Referring again to States 10, under injuries, external and internal, the last sentence of that paragraph indicates the injuries were labeled A through C for descriptive purposes only. What is the purpose of that? Explain to the jury.
So there were bruises and there was a stab wound. There's no way for us to tell the sequence, which came first, which came second.
Directing your attention to page 2 and to page 3 of State's Exhibit number 10, under where it says A, stab wound of torso. Can you please read what that paragraph says out loud to the jury?
So a stab wound is centered 21 7/8 of an inch from the top of the head and 5 1/4 inches left of the anterior midline. It's oriented obliquely, which means kind of at an angle, with a sharp edge angled to the upper left and a blunt edge directed down and to the right. It is 1 1/16 of an inch long, slit-like perforation on the surface of the skin without natural skin tension. After penetrating the skin and the muscle, the knife proceeded through the left 6 to 7 intercostal space, that's between the ribs, and perforated the pericardial sac and the left ventricle of the heart. There was approximately 750 milliliters of clotted blood in the pericardial sac around the heart, and approximately 1.8 liters of liquid and clotted blood in the left pleural cavity, which is the left chest cavity. And then the direction of the penetration is front to back, left to right, and slightly upward. In the estimated depth, that's how deep the stab wound was, the estimated depth of this penetration is approximately 2.5 to 3.5 inches deep.
Now, in reference to States 10, that paragraph you just read, what does it mean? What is that intercostal space notation? What is that?
So that's a term for between the ribs. So it went in the muscle part between the two ribs.
And what would be there? Is it tissue? Is it?
It's muscular and soft tissue.
And again, you indicated the pericardial sac and left ventricle. What does that refer to?
So the pericardial sac is the sac that the heart is enclosed in, and the left ventricle is the left side of the heart, the pumping chamber of the heart that pumps the blood to the rest of the body. So it's going to pump out through the aorta to the rest of the body. And there was a stab wound. The stab wound went through the wall of that left ventricle of the heart.
That next paragraph, there's approximately 75 milliliters of clotted blood in the pericardial sac. Is that normal to have that? What caused that? If you can explain that.
Yeah, there shouldn't be any blood in the pericardial sac. So that was blood from that stab wound, from the blood first going into the pericardial sac and then continuing into the left chest cavity.
Where it indicates that the direction of the penetration is from front to back, left to right, and slightly upward. How are you able to tell that?
So we do a dissection during the autopsy where we kind of go in layer by layer and we follow the track, the path of the knife, and we can then see the direction that it followed.
I'm going to direct your attention back to States 10, where it says, again, page 3 of 5, under where it says B, blunt impact injuries of torso, where it indicates that there was a 3/4 greenish brown contusion of the inframammary right chest. What does that indicate?
That means that there was a bruise on the right chest below the right nipple, and it seemed to have some age to it. It didn't look that fresh.
And how do you know about the age? How would we be able to tell the age?
Because of the green-brown color change.
And also, States 10 again, page 3 of 5, where it says C, blunt impact injury of extremities. It references some injuries there indicating a brown contusion, green brownish contusions, and red purple contusions. What does that indicate, that paragraph?
So there are scattered bruises. Some of them, they're of different ages. Some of them are more recent and some appear older.
What is the purpose of documenting such injuries?
It's just part of a routine part of an autopsy to document all the injuries. You never know when a particular injury may be important for an investigation.
So you'd indicated earlier that in addition to an external examination, there was also an internal examination done on the body of James Thomas McGrath. Is that accurate?
Yes.
And what parts of the body were subject to that internal examination?
All of the internal organs of the chest and the abdomen, as well as the head. So the brain, the heart, the lungs, liver, kidneys, all of those were examined.
And what is the purpose of doing an internal examination to all of those various parts of the body? If it's, I don't want to say pretty obvious, but if it looks to you where that injury might be, why do everything else?
It's just being thorough and looking for other maybe natural disease that could have contributed to death. We also want to collect various tissue samples for further testing. And so it's again, part of a kind of a routine autopsy to do that examination.
Directing your attention again to States 10, page 3 of 5, where it says cardiovascular system. What does that paragraph mean in layman's terms?
So that's describing the heart, the valves, the blood vessels, and he had other than the stab wound, he had a normal heart. He was a normal, healthy person.
So would it be safe to say that in that section, there would not be any indication regarding the injuries done to the heart?
Correct. We include the injuries in a separate section. So the internal exam is really just the kind of the natural, normal descriptions.
May I approach counsel, Your Honor? May I approach, Your Honor?
Yes, thank you.
Let's mark this photograph for identification purposes. Your Honor, let's-
I'll just take a quick glance. Thank you. Thank you.
Approaching the witness. Dr. Gill, showing you what's been marked as State Exhibit 11 through 20 for ID purposes only at this point. Do you recognize those photographs?
Yes,
And what do you recognize these photographs to be?
these are the autopsy photographs from Mr. McGrath.
Do the photographs that you see here fairly and accurately depict the body that came into your office on the day that the postmortem examination was done?
Yes.
And in the photographs that were depicted, does anything look different to you than the body of James McGrath did on the day of the autopsy?
No.
And again, the purpose of taking these photographs?
To document the findings, who he is, and any injuries.
Do you recall who took these photographs?
We have professional photographers who do that under our direction.
I'd like to enter these as full exhibit, Your Honor.
Attorney Smith?
No objection, Your Honor.
All right, court will accept into evidence State's Exhibits 11 through 20 as full.
Dr. Gill, for the next several questions, I'm going to be showing you what's been marked as State's Exhibits 11 through 20 as full exhibits. Can you see that, Dr. Gill, where you are? There's a
Yes.
screen also in front of you. Dr. Gill, what does this photograph depict?
This is a full body photograph of Mr. McGrath showing how we received him at the medical examiner's office.
And that placard that's placed above the body, what does that number refer to?
That's his unique case number.
And from looking at states, I believe this is states 11, do you see anything in this photograph that would depict any kind of, as you indicated earlier, the therapeutic services that was done on Mr. McGrath at the hospital?
Yes.
you just identify those areas to members of the jury?
You can see the breathing tube coming out of his mouth. In his lower legs, there are these two are called intraosseous catheters in both legs. And then there's some gauze pad over the left chest.
Referring to States 11, the lower left-hand area of the exhibit, there is a tag which is on the body of James McGrath's toe. What does that tag indicate?
That's how it's identification toe tag.
Showing you what's been marked as States 12. Dr. Gill, what is this photograph of?
This is a face shot of Mr. McGrath.
I'd say one more when you're on.
Certainly.
And that placard that again is depicted there, is that the same number that we saw in States 11? The number matches up, the ME number?
Correct.
Showing you States 13. What is this a photograph of?
So this is the face and upper torso of Mr. McGrath, and it shows the stab wound under that left nipple. You can see that red line is the stab wound.
And let the record reflect, Your Honor, that the witness is pointing to the right-hand side of States 13, where he's indicating there is a red line below the left nipple of the body.
So noted. Thank you.
And Dr. Gill, if you can look at States 13, there is some reddish purplish bruising appears around the neck area of the body of James Thomas McGrath. What is that?
That's called livor mortis. That's a change that occurs after death from blood settling in those areas.
Showing you what's been marked as State 14. What is this a photograph of?
This is a close-up photograph of the stab wound.
And again, that's the placard, the placard number that matches up.
Yes.
Showing you what's been marked as State 15. What is this a photograph of?
So this is also a photograph of the stab wound showing the skin, which is less relaxed. So the skin has a natural elasticity to it. And depending upon how the sharp injury is in the skin, sometimes it can cause the wound to gape open. In that first picture, we saw that gaping wound. This is kind of pushing the skin back together, relieving that natural skin tension so you can get a better look at the actual stab wound.
Showing you States 16. Dr. Gill, what is that a photograph of?
So this is after the skin of the chest has been reflected to the side, and we're looking at the chest wall, and just above the label, there's some bleeding there. That's where the knife went through that intercostal space.
Showing you State 17. Is this a close-up photograph of State 16?
Correct.
And can you also see in that photograph the puncture wound?
Yeah, there looks like there's some disrupted muscle there. It's difficult to make out.
Now, this placard that is utilized here, it looks like there is some measuring tool in there as well. Do you utilize that to measure the puncture wound or the injury?
Yes, that's always kind of on our label. Yeah.
Showing you State 18. What is that a photograph of?
This is showing the heart while it's still in the body, and that kind of oval red lesion, that's the stab wound of the heart, of the left ventricle of the heart.
So is that the heart taken out of that muscle or tissue that we saw in State 17?
So the pericardial sac has been opened, and we're looking at the heart inside the sac now.
Showing you State 19. What is that a photograph of?
This is let's see, showing the pericardial sac before it's been opened up. So you can see a little bit of lung, pink lung at the top there, and then that hole kind of right in the center, that's where the knife went through the pericardial sac.
And lastly, showing you State 20. Again, what is that a photograph of?
So this is a photograph of just the heart, and you can see kind of below the yellow, the fatty tissue, there's this darker red area. That's the actual stab wound that went into the left ventricle of the heart.
What is the purpose of taking this photograph with the heart removed from the body?
Just to further document the injury.
May I just have one moment, Your Honor? Dr. Gill, based on your training and experience in the field of forensic pathology, with respect to the stab wound to the torso, perforating the heart, what effect would you expect such an injury to have on a person's ability to survive?
Well, it would not be immediately incapacitating. The person would still remain conscious for a period of time until they've lost enough blood and the heart can no longer maintain the blood pressure. Then they would lose consciousness. And again, if the heart and the circulation isn't restarted, they would die.
Were any samples or specimens collected during the post-mortem examination of and submitted for laboratory analysis?
Yes.
And do you recall what specimens were collected?
There were several specimens collected for toxicology, including blood, vitreous fluid from the eye. We usually collect liver as well, and urine.
And what tests were conducted on the blood of the body that was collected?
So we did our kind of routine toxicology testing, which includes alcohol and all the common drugs of misuse, as well as other medications and so forth.
I'm going to direct your attention back to States 10 on page 5 of the toxicology report, withdrawn. Page 5, what does it read under the heading toxicology?
So it gives the positive findings that were detected in the blood and the vitreous fluid from the eye.
Okay. Directing your attention to page 2 out of 3 of the toxicology report. Do you recall or can you read what the blood alcohol content or BAC of the body of said James Thomas McGrath was?
Yes.
And what was that?
It was 0.2 gram percent or gram 100 per 100 milliliters.
Referring again to States 10, to the very first page of that exhibit where it says final diagnosis. Please read what it says.
Stab wound of torso with perforation of heart, hemothorax, approximately 1.8 liters. That's blood in the chest cavity. And then hemopericardium, that's blood in the pericardial sac, approximately 75 milliliters. And then superficial blunt impact injuries of the trunk and the extremities, the bruises.
Based upon your review of the postmortem examination of James Thomas McGrath, what was the cause of death in this case, Dr. Gill?
The stab wound of the torso,
And what was the manner of death?
homicide.
And if you could please explain your reasoning to the jury as to why it was a homicide.
Homicide for a medical examiner is death at the hand of another person. So this stab wound was caused by another person, so it's a homicide.
I just have one moment, Your Honor.
Yes,
I have no further questions for Dr. Gill.
thank you. Attorney Smith,
Thank you, Your Honor.
thank you.
Good afternoon, Dr. Gill.
Afternoon.
You told us that you have been at the Office of the Chief Medical Examiner since July of 2013.
Correct.
And did you take over from Dr. Carver?
Yes.
And you've been there since for the past 12 years?
Yes.
Any break in that time period? You've served continuously?
Correct.
All right. And you've told us that in conducting your autopsy, you discovered a 1 1/16 inch long slit-like perforation in the chest, correct?
Yes.
And you've described that both in your testimony and in the report as being the result of a knife, correct?
Yes.
And was that based on information that you had from other people involved with this investigation?
I think it's probably a combination. The features, the anatomical features are what we see with a knife injury. And I believe we had history that he had been stabbed.
And so did you come to that conclusion that it was a knife based on your own observations or based on something you had been told?
Again, I think it was a combination. The features are kind of classic findings for a knife. I really couldn't think of much else that would cause it.
No other sort of sharp object like a piece of glass or something of that nature?
A piece of glass wouldn't cause such a straight injury with a single blunt angle and a sharpened angle. And to that depth, I think it'd be very unlikely that a piece of glass would do that.
Any other tool, perhaps a screwdriver or something like that?
A screwdriver gives a different type of pattern, a more circular puncture type injury.
Fair to say you didn't have anything definitive at that point that led you to know that this was a knife, but that's what you concluded based on what you've described here to us?
Yeah, the anatomic findings are supportive, very supportive of a knife. Yeah.
And you also had information, I guess, from the police officers that were involved, or where did the mention of a knife come from?
Probably from the hospital that he presented with a stab wound.
And you described that this stab wound went through the left 6 to 7 intercostal space, correct?
Yes,
And you described that as being the space between the ribs.
correct.
And as you went through and gave us a list of your findings, you described also an injury under section B, which was an old bruise. Is that fair to say?
Yes,
And then under section C, a number of other scattered bruises of indeterminate age. Is that also fair to say?
correct.
Now, as part of your report, you said that the wound itself was an estimated 2.5 to 3.5 inches deep, correct?
Yes,
Why is that an estimated number?
because the heart and the body can move. And so if a person's leaning forward or laying back, there can be some movement of the heart. And so we can't give an exact, precise depth. Plus, if it goes into the heart cavity, we don't know how deeply it went into the cavity. It didn't go through the heart, through the whole heart, but it went through the wall. So we give an estimate. That's typical.
So based on a position, the person's body position when the wound is suffered, fair to say the stab wound could have been 2.5 inches deep, could have been 3.5 inches deep.
It's within that range, correct?
You didn't note any other fractures, correct?
Correct,
You didn't note any other puncture wounds, correct?
correct.
So this single stab wound that you've described to us, in your opinion, was both the only wound and the wound that led to his death,
It was the only fatal injury, yes.
other than what you've described as being old, unrelated bruises of indeterminate nature. Is that fair to say?
The bruising, yeah, that played no role in his death.
You also told us that you had ordered what was your standard specimen testing for toxicology reports, correct?
Yes,
And that included a toxicology for alcohol, correct?
correct.
And did you tell us that the blood alcohol of the deceased was a 0.2?
Correct.
Did that have any bearing on your findings in this case?
It played no physiologic role in his death. He would have died from this stab injury whether or not he had alcohol in his system.
And Dr. Gill, you've been called here today to tell us what you witnessed and observed as it relates to this autopsy, correct?
Yes,
And you've done that to the best of your ability.
yes.
But if this jury is interested in knowing why Mr. Valley did what he did that night, you can't tell us anything that would help them, can you?
No.
Thank you. Nothing further.
Thank you. Attorney Messina?
Just a couple questions.
Okay.
Dr. Gill, you had indicated on direct examination that you and your team determined that the fatal injury caused by the body of James McGrath was a stab wound, correct?
Yes.
Okay. And I know you had indicated earlier, but approximately how many postmortem examinations have you conducted or overseen where the cause was a stab wound in your
Objection, Your
career.
Honor, I believe this is outside the scope of my cross-examination.
Okay, so you did question the witness regarding other causes, so I'll allow it. Overruled.
Many dozens, but some of those involve, for example, in one person, maybe 80 stab wounds. So yeah, I've seen hundreds and thousands of stab wounds.
In those cases where you've determined it to be a knife, have those injuries been very similarly situated to what you saw on the body of James McGrath?
Yes.
And you had indicated on cross-examination regarding the difference between a knife perforation versus, let's say, a glass perforation. What would be the difference there?
A glass, because it's more irregular shaped, you get an irregular pattern and maybe more jagged. Usually it's not going to have that depth. This was a very smooth edged, straight edged, straight in wound. So that was caused by something that's sharp, long, narrow, and that's a knife.
You had testified on cross-examination that you were able to determine the positioning or how that knife went into the body of James McGrath. Would you be able to Would you be able to determine the position of James McGrath at the time the stabbing took place based on the injuries?
No.
I have no further questions, Your Honor.
Thank you.
Thank you.
Any additional cross?
No, Your Honor.
All right, thank you. All right, you may step down. Thank you. Please watch your step as you exit out. If you don't mind, I'll take that exhibit. Thank you so much. Returning exhibit 10 to Madam Clerk. Council, this appears to be a good time to move into our lunch break.
Yes, Your Honor.
All right. So ladies and gentlemen of the jury, we're now going to take a luncheon recess. We will be back in session at 2 p.m. and you should report back to the jury deliberations room so that we can start promptly. Please remember the rules of juror conduct that I told you about in the beginning of the case. As you're coming back into the building, if you leave for lunch, if you have to wait in line for a security check, please be careful not to position yourself near anyone who you've observed to be involved in this case, including the attorneys and other court staff members. They are instructed that they should not speak to you or make any comment to you about this case. Additionally, please avoid speaking to anyone while you're in the building regarding this case or otherwise, okay? That you will be escorted by the marshals. So thank you, have a good lunch, and we'll see you back at 2.